Some other miscellaneous structures to mention on the heart. Uh, Looking at the inside of the right atrium, we see muscle here. This is referred to as pectinate muscle. There's actually some similar muscle on the left side, but classically, pectinate muscle is designated in the right atrium, so that's what you see here. Also, you'll notice whenever the chambers are closed, you see these frilly looking structures here on the outside of the atria. Those are referred to as auricles. They resemble an elephant's ear, hence the name auricle. They actually contain little spaces inside of them, although you don't see it on the model. There are little spaces inside here that allow for extra blood content in the atria if needed. And so if we get extra venous return to the atria, these spaces can fill up with that extra blood if need be. Same thing on the left side over here. Also want to mention a couple of artifacts found in the heart, fetal remnants. If we look in the right atrium, we see a spot back here filled with connective tissue, a little round white spot. That is a structure called the fossa ovalis. It's a remnant of a fetal structure that was actually an opening that moves blood from the right atrium directly to the left. The fetus isn't breathing air, obviously, being fed oxygenated blood by mom. As a result, you don't need to send all of that blood out to the lungs and back through the pulmonary circuit. So some of that blood winds up shunting over from the right atrium to the left, bypassing that pulmonary circulation. So you're not sending blood out to the right ventricle, pulmonary trunk, and all that. Once the baby is born, that opening will seal up, and the connective tissue remnant we see here is the fossa ovalis. The opening in the fetus is referred to as the foramen ovale. Foramen refers to a structure that's a hole. And so basically that foramen ovale allows free blood flow from the right atrium to the left. That closes up after birth normally and becomes the fossa ovalis, which we see on the right atrium. There's another fetal remnant here, ligamentum arteriosum, that also shunts blood away from the pulmonary circulation. In the fetus, this is the ductus arteriosus. It's an open tube feeding from our pulmonary trunk area straight to the aorta, again bypassing the lungs. Now there is some blood that goes to the lungs, but a lot of it gets shunted out through these tubes. Once a baby is born, that ductus arteriosus will close up and become filled with connective tissue, becoming the ligamentum arteriosum, which you see here.